A 10-year-old patient with a known diagnosis of thalassemia presents to the clinic for a routine checkup. The nurse is reviewing the patient's recent laboratory results. Which of the following findings is most consistent with thalassemia? So if you say, well, I honestly don't know what thalassemia is. Well, you should know the other words, okay? So low hemoglobin hematocrit is anemia. So of the blood, low levels of red blood cells, anemia, or hemoglobin and hematocrit. Decreased white blood cell count, neutropenia, leukopenia, and then decreased platelet count. You should have learned in suffixes number 1, thrombocytopenia. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, and I'm so glad to see you today. Remember, if you're interested in taking the very best NCLEX review in the entire universe, in my opinion, you should go to clinicreviews.com and sign up for one of our NCLEX reviews. So today I'm going to be continuing on with the Blue Book. You can order the Blue Book at Amazon. Go to Mark Klimek Blue Book. I don't make any money off of it, so I feel like I can hype it a little bit. We're going to be continuing on pages 15 and 16. This is the second lecture under suffixes. So essentially we're doing vocabulary, y'all, and you have to know your vocabulary in order to do well on the NCLEX. Mark Klimek has said for as long as I've known him, the number one reason people fail NCLEX is they don't know their vocabulary. So let's go ahead and get started today. A patient complains of muscle weakness and fatigue after being started on a new diuretic. The nurse suspects the symptoms are iatrogenic. Which laboratory value should the nurse assess first? Now, you actually don't have to know what the word iatrogenic means in order to get this one right. However, the suffix we're doing today is genic, and the genic means to produce, originate, or become. To produce, originate, or become. And the word iatrogenic means produced by the medical treatment. So it's something that's this is being caused by the medical treatment. Iatrogenic means this is being caused by the medical treatment. So if we suspect the symptoms are iatrogenic, it means we suspect it's being caused by the diuretic, because the only medical treatment we know of the patient is on here is the diuretic. And so which laboratory, if they're on a diuretic, which laboratory value would we want to assess first? Well, the most common diuretic that we start people on is furosemide, which is a potassium wasting diuretic. We could also start them on hydrochlorothiazide. The ides are potassium wasting, and so we would want to check potassium. Now, you actually don't have to know what iatrogenic, this is just a testing strategy here I'm giving you. I'm not trying to say you don't have to know what genic, the suffixes are. But a testing strategy, if you do come to a word you don't know, you honestly don't know it, you can't figure it out, according to the rest of the question, you don't know the prefix, you don't know the suffix, you are allowed to ignore the word. You just ignore the word. So if you say a patient complains of muscle weakness and fatigue after being started on a new diuretic, which laboratory value should the nurse assess first? Well, we still would assess potassium first. We don't necessarily have to know what iatrogenic means in order to get this one right. However, the suffix here is genic, which means producing. So this is produced by the medical care. 65-year-old patient with a history of diabetes presents to the ED with a high fever, chills, and altered mental status, and the patient is diagnosed with septicemia. Which of the following is the nurse's priority intervention? So the suffix we're doing now is emia. Emia means of the blood, So septicemia is an infection of the blood, so an infection in the blood. So they come in with a high fever, chills, and altered mental status. We suspect it is an infection of the blood. Which of the following is the nurse's priority intervention? Administer prescribed antibiotics immediately, preparing the patient for immediate surgery, encouraging the patient to increase oral fluid intake, placing the patient in isolation to prevent infection spread. No, infections of the blood are not generally so infectious that they need to be in specific types of isolation, unless it's a resistant organism like MRSA or something like that. So we're going to cross off D. We're going to cross off B because we don't do surgery to treat infections of the blood. So it's either going to be A or C, because we do know that we need to increase fluid intake for someone who has an infection of the blood. However, it would be IV, high levels of IV infusion. So we're going to do the prescribed antibiotics immediately. Now, don't say, but I know we have to get the IV fluid started. You're right, we do need to, but that option's not here, y'all. Okay, that option's not here. And so we have to do the antibiotics immediately. A 10-year-old patient with a known diagnosis of thalassemia presents to the clinic for a routine checkup. The nurse is reviewing the patient's recent laboratory results. Which of the following findings is most consistent with thalassemia? So thalassemia is something of the blood. So let's see what our answers are. Decreased hemoglobin and hematocrit levels. Well, that's of the blood. Decreased white blood cell count. That's of the blood. Decreased platelet count. That's of the blood. Microcytic and hyperchromic red blood cells. So if you say, well, I honestly don't know what thalassemia is. Well, you should know the other words, okay? So low hemoglobin hematocrit is anemia. Anemia. So of the blood, low levels of red blood cells, anemia, or hemoglobin and hematocrit. Decreased white blood cell count, neutropenia, leukopenia, or agranulocytosis. Agranulocytosis doesn't have emia in it, so we'll just talk about neutropenia. Leukopenia is low white count, okay, or leukocytopenia would also be appropriate. And then decreased platelet count, you should have learned in suffixes number 1, thrombocytopenia, right? Thrombus, which is clot, cyto, the cells that cause clotting, emia of the blood. So that's decreased platelet count, because platelets cause clotting of the blood. So the only one left is D. So whether you want to learn what thalassemia is or not, you can deduce it by saying, well, I know what the others are. So thalassemia must be microcytic, which is small, and hypochromic, which is pale, lacking color, hypochromic, low color, red blood cells. So they're small, pale red blood cells is thalassemia. 4, a patient is scheduled for an exploratory laparotomy due to severe abdominal pain and suspected internal bleeding. Which of the following preoperative interventions is the nurse's priority? So laparotomy. So the suffix here is otomy, which means cutting. Otomy, cutting. So where are we cutting with a laparotomy? With a laparotomy, we're cutting into the abdomen, okay? Cutting into the abdomen. So we're cutting into the abdomen. We're going to exploratory laparotomy to see what's going on. We don't know what's going on. We're cutting in. We're going to open them up and see what's going on. They've got abdominal pain. We think there may be bleeding, so we're going to cut into them, see what's going on into the abdomen. So which pre-op intervention is the nurse's priority? Administering a cleansing enema? Well, yes, I would want to do that. Teach the patient how to use an incentive spirometer? Yes, I would want to do that. Ensuring informed consent is signed and on the chart? Yes, I would want to do that. Initiating IV antibiotic therapy? Yes, I would want to do that, because if we end up cutting into the gut, I don't want them to get an infection. So this is actually a testing strategy. I know we're doing suffixes, but this is also a testing strategy. When you see a priority intervention or best nursing action or most important nursing action, you should look for the most fundamental answer. So the reason you look for the most fundamental answer is because laparotomy, in this case, laparotomy is just a placeholder. They could have said anything. They could say laparotomy, thoracotomy, cardiotomy, whatever. They could say any surgery here, any surgery, and the answer would be the same. So best nursing actions, priority nursing actions are always some fundamental action the nurse should always take. That's why it's best or most important. So if you look at this, which of the following answers is always the most important thing, no matter what surgery they're going to do? Well, no matter what surgery, you have to get and informed consent, y'all. Do you need to teach in center spirometry? Well, that would be a really good idea. Should we start IV antibiotic therapy? Maybe. I mean, we might have to. I don't know for sure, but we might have to. Should we administer a cleansing enema? Probably. But y'all, we have to get informed consent. And that's why I say when the question says what's most important, best, or highest priority, you say, well, which of these is the most fundamental answer and would be the right answer no matter which surgery they were having. Question 5, a patient is recovering from a thoracotomy. All right, so that's cutting into the thorax or cutting into the chest, thoracotomy. Performed to remove a lung tumor. Which of the following post-op assessments is the nurse's priority? Monitoring the patient's urine output, assessing respiratory rate and breath sounds, checking for signs of infection at the incision site, encouraging the patient to perform range of motion exercises. Well, all these would be good. I'm going to cross off D. That doesn't seem to be the highest priority. And I'm going to cross off A just because it's a lung issue, so I'm not going to prioritize a urine output, even though I would want to check urine output. It's not going to be my priority because it's a lung problem. So do I want to listen to breath sounds, or do I want to watch for signs and symptoms of infection at the incision site? If you watched the lecture, the Blue Book lecture, where Mark talked about prioritization strategies and he talked about ABCs, and then I did some questions related to that in a separate video. ABCs, airway, breathing, circulation. When you have more than one physiological problem, one patient, and at least two physiological problems, one of the ways to choose between them is to do ABCs. So I realize these aren't technically physiological problems, but we're watching for physiological problems. So if we're assessing respiratory rate and breath sounds, we're watching for hypoxia, we're watching for increased respiratory rate, we're watching for crackles. So those are all objective findings. So we're watching for airway breathing problems and checking for signs and symptoms of infection. We're watching for infection. Well, infection is not ABC. So if I have to prioritize between a respiratory issue, objective respiratory problems, and objective infection, I have to go with assessing respiratory rate and breath sounds, because if we use ABCs, we're going to prioritize the airway breathing problem. 6, a 4-year-old boy is scheduled for an orchidopexy. Orchidopexy. All right. The suffix here is pexy. Pexy, which means fixation of something, fixing something. We're going to fix something. All right. Which of the following pre-op instructions should the nurse provide to the parents? Well, orchidopexy, that's actually, and you can tell because it's a 4-year-old boy, undescended testicles. When a boy has undescended testicles, they do an orchidopexy to surgically lower them, I guess. I don't know. Fix it. They're going to fix it. And so which of the following instructions should the nurse provide to the parent? Your child should avoid solid foods for 24 hours. No, you don't have to do that. Make sure your child does not eat or drink anything after midnight. Well, yes, that's always important for a surgery. And we know orchidopexy is a surgery. Your child will need to follow a clear liquid diet for 48 hours. No, that's not typical standard treatment before surgery. It is important to administer a laxative to your child the night before surgery. No, orchidopexy is testicles. It's not GI. So the only one that makes any sense is B, make sure your child does not eat or drink anything after midnight before the surgery. Question 7, a newborn is diagnosed with tricuspid atresia. Which of the following findings should the nurse expect during the initial assessment? So it's a word, it's not necessarily a suffix, but the word atresia means condition of occlusion, condition of occlusion. So something is occluded, it's closed, something where there's supposed to be an opening, there's no opening. Okay, no opening. So the tricuspid valve is the valve in the right side of the heart, between the right atria and the right ventricle. Y'all, if you don't know blood flow through the heart, you don't need me to teach it to you. You can Google it. If you don't know blood flow through the heart, you're not ready to take your NCLEX, okay? Don't take your NCLEX until you know blood flow through the heart. So blood flow through the heart, right atrium, through the tricuspid to the right ventricle, then to the lungs, then to the left atria, then through the mitral valve, and then into the left ventricle. All right. So if the tricuspid valve is occluded or closed off. There's supposed to be this opening between the right atria and the right ventricle, and there's no opening there, y'all. So where's the blood going to go? I don't know where it's going to go. It's not going to go anywhere. This is a serious, serious, serious congenital heart defect. Okay, very serious. So if we have blood that's not able to get to the lungs, the blood cannot get to the lungs to pick up oxygen. What are the symptoms going to be of that? Bounding peripheral pulses and hypertension? Well, no, the blood flow through the heart is significantly decreased. So absolutely not. Elevated blood glucose levels and polyuria? Absolutely not. Absolutely not. Has nothing to do with that. Jaundice and clay-colored stools? No, that's liver. Cyanosis and difficulty breathing? Absolutely. They're going to be very cyanotic because they're not getting any blood to the heart, to the lungs to pick up oxygen. They're going to be extremely hypoxic and have a lot of trouble breathing. They're going to be short of breath for sure. Dyspneic and hypoxic. A 2-month-old infant is diagnosed with biliary atresia. So the bile ducts are in the liver. They're supposed to be carrying bile through the liver. Well, there's biliary atresia, which means they're blocked. The bile can't go through the liver. Which of the following symptoms would the nurse most likely observe during the assessment? Cyanosis and clubbing of the fingers. No, that's a respiratory problem or cardiac. Frequent urination and weight loss. No, that's not really a liver symptom. Jaundice and pale stools, that's definitely a liver symptom. Hypertension and bradycardia, no, that's not a liver symptom. So biliary atresia is blockage of the bile ducts, which is going to cause liver failure symptoms. So you're going to have jaundice and pale stools. Question 9, a patient recovering from severe spinal instability has undergone a surgical procedure that involves the fusion of several vertebrae. The nurse explains that this procedure is known as. All right, so the suffix that we're doing here is desis, D-E-S-I-S. Desis means binding or fusing. Binding or fusing. The other one is ectomy. Ectomy means removal of. Ectomy means removal of. So if we're looking at fusion of several vertebrae, spondylodesis, I don't know how to say that word. I've never actually said it out loud before. Spondylodesis. That's a fusion of something. Sounds like a spinal thing to me. Arthroplasty. Remember, plast is plastic surgery of a specific part. Arthro is joint. So arthroplasty is a repair or plastic surgery of the joint. Laminectomy is removal of something. And in this case, it's removal of the lamina, which are the vertebral spinous processes. So it is in the spine, but it's removal of bone. Discectomy, that's removal of discs. So the only one that has anything to do with fusion is spondylodesis, or however you say that word. So I hope this helped you. Vocabulary is so critically important for you to know and understand to be able to read and interpret the NCLEX questions. I hope you have a great rest of your day, and I'll see you later. Bye.